everybody. Welcome and thank you for joining me at Carroll PMC's video interview series today. I'm excited to have you all with me as we discuss another's journey through medicine. And today I have a great guest for you all, as always, Dr. Amy Matheny. She is a family medicine physician serving as immediate past president of the Montana Academy of Family Medicine Physicians and the associate program director of the Family Medicine Residency of Western Montana in Missoula. She is originally from Rhode Island and shares incredible insight into some of the characteristics and qualities of her undergraduate institution and how they can be likened to what Carroll College is all about, as well as what made her move out west, what made her move to Montana, and what motivated her to pursue her career in family medicine, and specifically in rural medicine, and what prospects she has for the future of medicine, the future of rural medicine, as well as some of the challenges that the field's facing, but as well as some of the really large proponents that are in support of some of the remedies to some of those challenges as well. So let's jump right in and say hello to Dr. Amy Matheny. Welcome, Dr. Amy Matheny, to Carroll PMC's video interview series. It is great to have you with us.
Thanks. It's so great to be here with you all.
When did you realize you wanted to become a physician?
I always find that a funny question because I decided I wanted to become a physician when I was like 12, which I'm not sure was completely informed very well at that point. But at that stage of my life, I had done some volunteering in a local hospital and just really loved helping people. And obviously that's what a lot of us say when we choose a career in medicine, but that was sort of the roots of it for me. And I also really loved science and science fairs and just loved the field of scientific topics. And so it felt like a good fit. And I stayed on that path, even though I certainly came to understand it better as I got a little bit older, both through high school experiences and into college and beyond. But yeah, the roots of it for me were pretty early.
Yeah, it's that typical love science, and love to help people. That's usually the trigger for us pre-meds to get interested in medicine. But oftentimes, all of our advisors here at Carroll say, do not put that as your only reason to go to medicine. I think one aspect of that is that it's kind of broad in that you could be a nurse, you could be a PA, you could be a tech, and these jobs become more apparent during these years, especially when we're looking for those clinical experiences. So was there a particular interest at a young age, maybe like a physician you idolized, or a moment with your pediatrician or something? Was there something like that to get you interested in becoming specifically a physician, or was that later down the road?
That's a good question. And it's been so long, I have to really think back. Honestly, in some ways, my mom was a nurse and is a nurse and, just grew up just with an awareness of the healthcare system. So I don't know. I'm not really sure why doctor clicked, actually, honestly, in the beginning. I guess I would say I probably didn't know a whole lot about some of the other avenues, at least in healthcare or public health or any of these other areas. And so I think for me, it was just more of an awareness of, well, doctor, that just seems to be the path. And then just kind of got on that sort of pipeline. But yeah, it's really interesting because I think without a knowledge of all the different ways you can help people, which looks very different, and there's many ways you can have a career in healthcare to help people. And ultimately it is really trying to find that right niche for you, because it can be done in many ways.
Definitely. Could you share with our members just a little bit more about where you grew up, about your family, and maybe did your mom introduce you to medicine at all, or begin your interest in medicine at all as a nurse?
Yeah. Well, I'm originally from New England, from Rhode Island, so a very small state that's about the size of Missoula County and has about the same population as the state of Montana. So very different place than where I've been for the last 9 years or so here in Montana. But I grew up in Rhode Island and pretty much did all my schooling there. But I certainly keep my first physician in my family. But certainly, like I said, my mom being a nurse just always had this awareness of healthcare, just talking with her and being in the car, talking on the way to work and school about just stuff going on in her work life as I got older and just came to know more about it and understand it. And just very much engaged in volunteerism as a high school student, and just loved finding lots of different ways to do that, whether it be healthcare or otherwise. And as I found my path to college, at Providence College in Rhode Island, a very similar kind of school in many ways to Carroll, I was a pre-med and was a science major and chemistry major on a pre-med track, and yet I also was really drawn to this program at my college, a minor in public and community service. There was actually a major as well, but with my pre-med studies, I pursued that as a minor. And it was really formative for me in many ways, I think, to better shape what my intentions were with a future in medicine. I had always been passionate about just the concept of service, and yet it gave a little bit more structure to what that really meant to me. Very much concepts of social justice and thinking about how healthcare actually contributes to that. So in a lot of ways, I think my passion for medicine evolved into, social justice really informing that. And so, yeah, that's a little bit about my path, but let me know if there's more questions that I didn't quite answer in there.
No, you're doing great. Yeah, Rhode Island's definitely far away from Montana, and I can't wait to get into how you ended up so far west. But I love how you first alluded to how, Providence College is very similar to Carroll in that it's smaller sized, private, Catholic, liberal arts college. And yeah, here at Carroll, and I'm sure at Providence, they've really pushed the liberal arts, the holistic education. That's something that I think medical schools, just upon reading and doing research about it when I was a young pre-med as well, younger pre-med, I'm still quite young, but just looking into it, medical schools like that holistic education. I think a question that comes up for a lot of our members is how much to focus on that part of your application, because the sciences and that science and math GPA are so heavily weighed upon at the admissions table still, and pre-med still feel the stress of that, of needing to do well in STEM fields. And so do you have an idea of how much, maybe a ratio as far as how much to focus on science, or how much to focus on liberal arts and other passions? Do you think it could be defined with a ratio, or do you think it's more of like a qualitative thing, like whatever your path?
Tough to say a ratio, yeah, and obviously that may also differ school by school, and the culture of some schools and some institutions really, which also hopefully can, be when students are searching for the right fit for them. Sometimes it's good to think about, is this a school that really fits my values? Obviously, you just want to get into med school and go somewhere, but it is definitely something to think about, because some places have a little bit different culture and a little bit different sort of focus in terms of what their medical school culture is all about. But all that being said, I think first and foremost, it's really important to focus on what you as an individual student are passionate about. If the sciences are the thing that you love, and whether it may be a future path in research within medicine, and that's what somebody really wants to do, I think let that shine through. Certainly we all know the importance of working hard and doing well in the sciences and mathematics and et cetera, all those prereqs basically for medical school, and that is critical and important. But of course, I think more than anything, schools, and even up into the level where I work in terms of residency post-medical school, really just looking for what somebody's ultimate passion is all about, and that comes through. And so if liberal arts, if that's that other piece, like for me, it was the service and social justice, and that was the thing that sort of defined what I was all about coming into medical school. And I think if it's writing and narrative work, which can translate into narrative medicine, wonderful, that somebody just kind of has developed that passion and can speak to it. And if that passion is the sciences, great. We need researchers and people that love to do that too. So I don't know that there's any one perfect ratio, because no two students are the same, and we want diversity within our classes too. If you had everybody that was all one kind of focus or the other, you wouldn't have that diversity and richness within an individual med school class too. So yeah, there's a few initial thoughts on that.
Of course. Yeah, and I think the newest MCAT, the 2015 MCAT, really showed that medical schools are looking to diversify, not as heavily in the sciences, but the whole psych and social section that's on there now. That is evidence that the social justice aspects of medicine and socioeconomic disparities in access to healthcare, those things are becoming more apparent and more prudent for students to look into. And so I'm curious, while we're on the topic of the MCAT, can you reflect on the experience with that major obstacle in the pathway, as well as the medical admissions or medical application process as well? It's quite a 1 year, not so easy footing trail, but yeah, what ultimately drew you to the medical school that you chose as well?
Yeah, well, it is an interesting question actually for me, because I had a slightly different path than some students have. And partly that's because I came from a state that doesn't have a state medical school, for one thing. So I didn't have that option in applying to medical school. And in Rhode Island, at my particular college and a couple of other universities and colleges in Rhode Island, they had a program with Brown University where I went to medical school to basically for students who are interested, who are pre-med and interested in applying to medical school, who are from Rhode Island, could apply early and sort of be identified early. And then as long as they continue to maintain grades and all the requirements kind of going through the later years of college, they were basically, it's kind of like a pre-acceptance to medical schools. So it was a little bit of a different path. And I guess I'll reflect on the fact that I took that path and was fortunate in my sophomore year to know that I had that pre-acceptance. And so it was like a state benefit, although it wasn't a state tuition benefit, but it was a state, being an in-state resident benefit. But I was a little bit apprehensive, kind of to your question about picking the right school. I was a little bit apprehensive because I was going with this path, and it was a wonderful school, and I have no regrets at all, and knew that it would be a great experience. But I had a little kind of nagging feeling of, am I missing out on other opportunities of other places I could apply? Again, to that point where, schools will have different cultures and different feels, and is this going to be the right one for me? And so I can't speak as much to the interview trail and sort of that piece of the experience, but I think in the end, again, it is something to really think about, that, when you're looking at schools, and again, even the osteopathic route versus allopathic route, DO versus MD degrees, and all those different options, to really think about what are you hoping for in your med school experience. Obviously, you want great training, but also what's the culture, what's important to that school, to that school's culture, and something to think about as you kind of build your list of places to apply.
Definitely. Do you have any not preferences, but do you have any ideas as to how in 2021 us pre-med should differentiate between MD versus DO?
That's a really interesting question. And I'm an MD, so personally don't have experience myself in the DO route, but work with many osteopathic colleagues, both in the residency program where I work and also with our residents, not just the faculty. So, there's some different philosophies in terms of osteopathic versus allopathic medicine. I mean, the core components of medicine is the same in terms of treatment of disease, but osteopathic physicians develop a little bit different skill set in the realm of musculoskeletal care, but really osteopathic treatment extends beyond just musculoskeletal care too, which I've come to learn and appreciate from my osteopathic colleagues. And I think you'll find, although not all schools are created the same, again, in terms of this concept of culture, but you'll find some schools where if somebody's really passionate about primary care and really has a feeling that that's the route they want to go, or conversely, if someone's really passionate about research, maybe they want to get an MD PhD or an MD or DO PhD, they might go to a different school where some of those things are more emphasized. I think generally speaking, I've seen more on average emphasis of primary care in many of our osteopathic schools and programs, although that's not a universal statement either, for sure, but it's something to think about. And of course, they're depending on location, that will certainly determine opportunities too in terms of urban or rural, or what type of rotational experiences someone wants to get. And granted, you can find any and all of those in either DO or MD schools, but it's definitely worth taking a look into, because, and maybe learning a little bit more, especially about osteopathy. I find people are maybe less familiar with the DO route than the MD route. So it's great to do a little bit of research and see which sort of feels like a fit, or apply to both, and get a feel as you interview.
Yeah, and I think it helps that the DO and MD, the match process, the merge of that, helps down the road. Now that's down the road, but as far as medical school decision side of things, ultimately I think it still comes down to fit. That's what pushed me to apply to the schools that I applied to, and that's what advisors here at Carroll, that's what they support, and that's what they tell us to do. And yeah, I think it ultimately depends on fit.
Yeah.
And I agree with you in the sense that I think a lot of us are really looking to like diversify our experiences and make sure that we're not just narrowed and wrapped up in one area and one community. It sounds like you did that during medical school, because if I'm correct, you studied at Harvard School of Public Health, like between your third and fourth year of medical school, for your MPH. Two questions. What was that like? And what pre-med would you recommend pursue as an MPH?
Yeah, great question. And it was definitely I always joke, we took a year off, but like people would always say, but you're still in school, you're not really off, but it felt like a break after a third year of medical school. But yeah, again, I think it circles back to, for me, my passion for community-oriented approach to what I wanted my career in medicine to be. And public health felt like, a clear connection to that. I've gotten this question from others, that taking that break between third and fourth year for some folks feels really intimidating, or, concern about, am I going to be able to come back after a year and still jump right back into clinical rotations? And that went smoother than I expected at that point in my life. I wasn't so sure as a med student, but I was really passionate about getting some additional training. And it is a little refreshing, because certainly, even though medical schools, I think, have been doing such a better job in the recent years to incorporate more than just the hard sciences, and, thinking about the big picture in terms of health disparities or psychosocial aspects of care, which are arguably just as important in practice than obviously knowing the science. But nonetheless, it was a nice break to think about something different and on a totally different level than the individual body system, treatment, going through all my clinical rotations in the third year, to like blowing it way back up to thinking about the community, the greater population, the country and beyond. So that was really a great break. And the thing I say, though, about pursuing, say, an MPH, or maybe any other, there's other types of master's programs you can do, and some medical schools have combined options. And I think just be really clear about why you're doing it. I would encourage someone not to just do it, perhaps, if it feels like, gosh, that'll look really good on my resume, or because if you're not passionate about it, it's probably going to be just feeling like a lot more work and a lot more, drain from one's kind of academic energy. But, and just kind of get a sense of what you want to do with that degree. I think especially for public health, there were lots of really interesting classes that I felt like I could take, but I really was trying to think about, what do I want to do with this, rather than just have a broad foray into public health for a year. For me, I focused a little bit more on program planning, evaluation, some policy work, because that was another interest of mine. So I tried to come out with some real tangible skills, and that I hoped at the time to apply in the future. So I think it's, thinking about, before a degree like that, what skills are you wanting to come out with? What are you hoping to do with it? And if you're not sure yet, maybe it's not the time. Maybe it's something to think about later in one's career or training. There's some residencies that might offer opportunities like that. So yeah, I think it's all a matter of kind of thinking about what one's goals are.
Yeah, it's when we did a presentation on this last semester on just the different master's degrees and things you can get in medical school in conjunction with just your MD or your DO, I was shocked to see how many things that you can do. And so there's definitely a variety of different things, or different ways in which you can complement your medical degree. I think, that's great advice, to just tailor to you and suit it to what you do best. While medical schools have a great amount of resources, and the experiences that you could have during that time could push you towards one certain avenue, it's great and reassuring to hear that you can also pursue that at a later point in life, even to the point of you're smack dab in your rotations, and you can pursue, or you can take a year off or with some change, and you can actually pursue that and see if it's right for you. So that's good to hear. And getting more towards your specialty now, family medicine is considered one of the most versatile physician specialties of all time. Was it the comprehensive medical care, the diversity of patients, or something else that led you to pursue this specific specialty?
I think it's a little bit of all of that, but a little bit more too, for me in my path. When I came into medical school, I didn't really actually have a good handle on what family medicine was. I didn't really have much education about it as a pre-med, and I grew up in the urban suburban Northeast, and there are plenty of family physicians and family medicine training there, but there was a little bit more of a mentality of, you go to the pediatrician for this issue, you go to the orthopedist for the comprehensiveness is I just didn't see or experience myself growing up. So when I started my first year of medical school, I was just sort of bright-eyed and bushy-tailed and open to everything. And ironically, the way I sort of found my way to family medicine is the family medicine interest group at my medical school was looking for a first-year medical student who would be interested in trying to help lead the group and kind of take the reins. And I was just eager to be involved in stuff, and that sounded of interest to me. And so I took that on, and then of course, over the course of the year and beyond, started to really learn about what family medicine was, the comprehensiveness, and that was amazing. And I think, though, really the turning point for me, I had a chance to go to a national meeting from the American Academy of Family Physicians, which is the national physician group, which is also very engaged with medical students. And they have a whole medical student meeting. And so I was at that meeting as a first-year student and just attended some lectures about the history of family medicine, the future of family medicine at that time, which was like 15 or 16 or 17 years ago. So now I feel old, but it was just really interesting to hear more about the context of the specialty, because it's more than just a generalist, which is kind of the old term for family physicians many years ago. But the specialty was actually founded as a specialty of medicine, a discipline of medicine in the late 1960s. I think it was 1969. And it's not a coincidence that that was around the time of the civil rights movement. And there was a move in the medical field to really relook at how we were treating patients. There was definitely sort of a specialty, very siloed approach to medicine that was sort of evolving in the decades preceding that, where, there was just focus on the heart or the liver or, all these different individual systems. And we were losing the individual whole person in the midst of that in the context of medical care. And there was very much a move at that time from the original founders of the specialty to think about patients as whole people, as whole individuals, not just someone with a liver problem, et cetera, and to think about them in the context of their family, their community, with a biopsychosocial model of healthcare, where of course you got to know the science and the pathology and pathophysiology to treat disease, but the overlay is huge when you think about either the psychological impact of disease or the impact of mental health challenges or social difficulties on health, and all that mixed together. And for me, someone who is passionate about social justice, when I kind of learned that that's what family medicine was all about, it just all made sense to me. Like, how could I do any other specialty? And of course you can, and you can practice with that mindset in any field. But for me, that the discipline was so founded in this concept just felt like the perfect fit. And when I went through my clinical rotations, thankfully, I really loved everything. So it still felt like a fit when I loved delivering babies and taking care of kiddos and taking care of geriatric patients. And that just felt like it was all coming together for me.
Yeah, it's such a versatile specialty because you can do a little bit of everything. Did you consider getting any subspecialties in family medicine as well, or did you get any subspecialties?
Not officially, although there are what's called fellowships, which are things you can do after residency training. In family medicine, there's things like sports medicine, geriatrics, palliative care, and others where you can get some additional, it's called a certificate of added qualification. And, I think in many ways, a lot of family physicians, even if they don't necessarily do a dedicated fellowship, a lot of times people will develop a bit of a niche. For me, actually, a very unexpected niche that came to develop over time for me has been a focus in hepatitis C care and HIV care, which is part of my practice and has grown as part of my practice over the years. And I didn't go into residency even imagining that, but I think a lot of times the beauty of family medicine is you are trained so broadly, and it is such a versatile field that when you arrive in a community to provide care, you often can flex those skills to meet the needs of your community. I was in a place where there was no one else available to treat HIV for a small panel of patients, and so I learned how to do it. I had learned some in residency, but needed to learn more even after, and now that's been a very big part of my practice. So in some ways, you can sort of develop the niche even along the way without necessarily an official program. But that's the nice thing with family too, is, even if you take different jobs over the course of a career, it can look very different. And you can, again, make use of that training to have a different and varied career rather than feeling like you're doing the same thing for 30 years.
Yeah, and speaking to your residency, you ventured west to attend residency. So we're getting out west now, and you're in Idaho in a program which it touts its ability to recruit these residents who are committed to rural and underserved medicine. And so I'm curious what spawned your interest in rural medicine, because there's a family doc in urban areas can be quite different than a family doc in rural areas. And so I'm curious what spawned your interest in that.
Yeah, that's a really great question, and a big piece of my own story, I guess, that we really haven't touched on yet. But and for me, it actually it kind of goes back to my pre-med years in college. And I remember seeing on like a bulletin board in my sciences building this poster for something called the National Health Service Corps. And I saw the word service in health, and I thought, oh, that looks like it's interesting. And so I kind of pulled off one of the tear-off sheets and had it tacked to my college corkboard all through my years of college. And it was a program that wasn't really relevant to me as a college student yet, but it sort of was always there as a reminder for me as I entered medical school. And the National Service Corps is a program that offers both scholarships on the front end or loan repayment kind of on the back end once you get a job, for health professionals of varied fields, but particularly since we're talking about pre-med, for physicians who are entering primary care practice. And at the time, as a medical student, so I enter in my first year, I'm like getting super passionate about family medicine. I'm pretty much convinced that's what I want to do by the end of my first year of medical school, even though I hadn't done any clinical rotations yet. But I really wanted to apply for the National Service Corps scholarship. Again, I mentioned as a student from a state who did not have a state school, the tuition, there's a little bit of a intimidating thing to not have some of those options for tuition benefit. So I was, I was committed to the idea, because National Service Corps seeks to put primary care physicians in underserved, both urban and rural communities. And so I was dedicated to that concept. So more than really just helping to pay for some of medical school, it was still just something I was passionate about. So I applied, I ended up getting accepted. After my first year, even though some people told me to beware, maybe you don't want to do family medicine, but I knew in my heart I did. And so ultimately, with the National Service Corps, the requirements to sort of provide back service for the scholarship is to practice in an underserved community upon finishing residency. And as I came to learn more about family medicine, I happened to get to meet family doctors from the West, especially the Northwest, Intermountain West, some folks from Idaho in particular. I was just really intrigued by the level of comprehensive care that they were providing, especially in rural communities. And I thought I wanted to be trained in that type of family medicine. And you can be trained in that type in urban settings too. It's just different. And it's definitely a different culture and mindset of all that family medicine can be. And so I started to just realize, okay, I think I want to do my National Service Corps service in a rural place, which is completely opposite of where I grew up. I had no experience in rural, but nonetheless, I pursued a program where I could get that training as a resident and then be comfortable thus entering practice. And ultimately, my first practice was in Butte.
Oh, nice. Okay. Yeah. If this is correct, so it was a loan repayment program that you chose to go through the Health Service Corps.
Well, there's two different options. There is a scholarship program, which as a medical student, one could apply for. And then that's sort of, you kind of have that scholarship on the front end. But for lots of folks, if they're like, gosh, I don't know that I want to commit to primary care right away, especially before clinical rotations, there are opportunities for loan repayment after the fact. So ultimately, someone's graduating from residency, ready to get their first job, they can look at sites that qualify, and they might have still accrued that debt from medical school, but then they can apply for loan repayment. And so there's different paths. For me, it was on the scholarship end, but for many folks, they go the loan repayment way. It does allow more flexibility of where you can end up. For scholarship program, there's more restrictions on what sites qualify for service, whereas loan repayment, there's more places that would meet that criteria. So for someone who might want a little more flexibility in their future of where they may end up, then loan repayment might be a better way to go.
And if I'm correct, just the National Health Service Corps, they offer these loan repayment programs in areas that aren't just rural, but there are urban area settings as well that are just classified. I forgot what the scale is, but it's classified as like, so there is some numerical system that classifies some urban areas as underserved. And
that's right.
Your loan repayment there. I actually think the neighborhood that my high school is in, is an underserved area,
Hmm.
and I had no idea when I was kind of scouring that website.
Oh,
So
interesting.
there's
Yeah.
opportunities all over the place. But
There are, yeah, HIPSA score, health professional shortage area. I think
that
is
is it.
what you're referring to. And
Yeah,
yeah, and I mean for urban, at least back when I was kind of going into service for urban settings, yeah, there were, and it depended though. Scholarship, there might have been less, even like Rhode Island, for example, at the time, didn't have any sites where I could have done my scholarship. The scores weren't high enough. The higher the score, the higher the need. So interesting, so that's just something to keep in mind. It's getting a little into the weeds maybe for the program, but yeah, definitely want to at least have a sense of where one may be restricting oneself versus where one might need more flexibility depending on their life circumstances. I was kind of open to whatever, so I was more comfortable with the more restrictive option.
that's interesting. That's great insight into knowing that the scholarships can be more restrictive,
Yeah,
and the loan repayments can be more open. So that's good to know, I think,
yeah.
for us pre-meds. And I'm interested. So you chose the rural medicine to look into it. Upon viewing this and dedicating yourself to this area, what are some of the largest problems you see facing the delivery or access of medicine in rural areas?
Yeah, I mean, there's a lot of different perspectives you could take with that. I think a few things that come to mind first. This is in no specific order, but certainly in part of my life as a residency faculty, definitely think about this on a frequent basis. We want to make sure we continue to have a pipeline of physicians and other healthcare providers for rural communities. And that kind of comes into play both for those who are matriculating into medical school. The more folks we have from backgrounds that are also rural, the more likely they may be to return to a rural place. I mean, I was sort of an outlier a little bit, coming from somewhere urban and going somewhere rural. That happens less often, although it sure does. But yeah, I think the physician supply, so to speak, in rural communities is definitely a concern, partly because there are a lot of docs in those communities who may be approaching retirement in the next 5 to 10 years. And so we need to have a continuous pipeline to make sure those communities don't lose their healthcare, foundation in terms of the providers who are taking care of those communities. And especially in rural communities, and you see this particularly in Montana and states that are similar to us in terms of rurality. But in a lot of these communities, it is family physicians and others, but more often than not, family physicians that are providing that coverage of care between the hospital to the clinic to the ER to the labor deck for delivering babies and everything in between. A lot of these smaller communities might not be able to support a physician who's more specialized. There just might not be enough volume for the physician to have enough kind of folks to care for, basically. But you take a small town and family docs and NPs and PAs that also work in those communities are core. So if you lose one, you could really lose a significant amount of healthcare. So definitely thinking about pipeline is always important, and to keep our eye on that ball. And for our residency programs, particularly those here in Montana, that's what we're really shooting to train residents for. I think other issues, certainly just access to care in general is always a challenge, and making sure all aspects of care are good access for folks. Not every community delivers babies, as an example, and so how do we make sure moms who live far from care are still able to get the care that they need? And there's lots of different examples of that, but just that variety of access to care for certain communities is a challenge, and there's some true logistics to that. Like some places just can't maybe support delivering babies in their hospital but there's definitely a lot of considerations related to that. Those are a few things that come to mind. I think there's probably more I could think of, but does that spark any other questions?
Yeah, I think you touched on a lot of great ones. I think disparities in access to healthcare is something we see all the time around here. As an EMT in a private ambulance company that services quite a rural county, I see it all the time. I mean, we have to get out to people, get emergency care, maybe not family care right now, but like emergency care to people who live up top of a mountain, or who live in a community that does not have a physician in that community, and then we'll have to transport them to the nearest ER, which is almost an hour, maybe sometimes 2 hours away. We've had to transport people to Butte before, so, and you know how the roads are winter. So there you go. So yeah, access to healthcare, it's a huge issue here specifically that I see a lot. I'm curious, once you got to Montana, because you moved from Idaho to Montana, And I'm sure that there might be some crossovers in the question we just answered, but what pleased you and displeased you about medicine and healthcare in Montana from your perspective as a physician?
Yeah. Well, the first thing, for whatever reason, that really popped into my mind is, I really just so respect and have loved my professional community in terms of the family medicine community in Montana, and having that network as I was a new physician here and came to be involved with our state chapter of the Montana Academy of Family Physicians. Through that, got to know a lot of family doctors from various parts of the state, and have just been so impressed and supported in many ways by those family medicine colleagues. It's just incredible the things that you see a lot of these family docs doing to serve this communities in this state. I mean, it's not tongue-in-cheek to say they're heroes, and for a lot of these communities, they are the backbone to healthcare and ultimately well-being for so many Montanans. And so anyway, I just was so pleased to be a part of that network of amazing family physicians that I think are some of the most brave and amazing in the country. Of course, I'm biased because I work with so many of them, but I really believe that. So that was really a great community to come into. And I think just in general, I'm just pleased with how working in Montana because of that really allows such a breadth of practice for whatever someone really wants to do. Again, for me, I was able to develop this surprise and really exciting niche in HIV care, which I don't know if I would have found in any place. And it was driven by the fact that there are difficulties with access in rural communities. Therefore, there is this need for us to fill that space. And so I liked being able just to see that in action and to have opportunities to have the scope of practice that I wanted. I laugh. My program director from residency always used to call us pluripotent stem cells, that we, as residents trained in family medicine, you could develop into anything, and you have that foundation to then develop into whatever family medicine stem cell you're going to be. But so yeah, I like that Montana gave me that opportunity. So yeah, and I think, did you ask about challenges as well, or?
Yeah, I did ask about that. I love the pluripotent stem cells thing, by the way. That's great. But yeah, just anything that displeased you about Montana in particular, which I mean, there are challenges, and you know what, we strive to face those challenges and remediate them. But I'm just curious, from your perspective as a physician and coming from out of state, what displeased you?
I guess the first thing that comes to mind is, at the time when I came to Montana, was at a place where we were just barely seeing the evolution of the Affordable Care Act. And so, and why I bring that up is just the access to healthcare coverage, which, has evolved over the 9 years, at least, that I've been in Montana. We've seen Medicaid expansion, because I've always worked in community health centers and in that type of clinic environment, which again is taking care of underserved patients, takes care of everyone regardless of ability to pay. So we had many patients who had zero insurance coverage. And when you start to think about how that can snowball when somebody has some particular healthcare problems that either you're trying to prevent or they're already happening and you can't evaluate because the person can't afford to have the test, it's maddening, because you just see what's going to come of this, and it's usually not good for the individual or for their family. So to see that was really distressing, although it's true all over the US, but it's felt differently in different states, because coverage just looks different in every state just by virtue of the way things work. So it was really exciting when we had Medicaid expansion in Montana, because it added to the number of folks we could provide healthcare to and not have individuals potentially suffer unnecessarily simply because they didn't have access to primary care. We can't take that for granted either, because that may not always be the case. These things always come back up for vote, and it's something we can't take for granted. So I think that's something we always have to keep an eye on the ball for our patients and communities in the state.
Yeah, I think I expect you to go somewhere with that realm of the questioning. It was something that I'm originally from Chicago, and I came here. And the second I came here, one of my biggest concerns as a pre-med and prospective medical student was, I could choose an ER within like an hour radius. I could choose from like 6 of them, like back in my hometown, versus here there's not as much resources or not as much institutions for medical care. And that was one of my biggest concerns, not just for me and like shadowing experiences, but I mean just the patients we were going to serve, and the people that were in the communities as well. And I think And it's oftentimes it's heard that people from more rural areas, they grow up and they leave the communities, and now we are left with these communities in Montana, which there's just not as much youth are staying, and so the new generation is not able to revamp things. And it feels like, I mean, I know we're out west and our time zones are a lot later than the east, but it just seems like we're a little bit more, we're later on. We aren't as evolved as some other areas of the country. However, I think that some of the residency programs and some of those loan repayment scholarship programs and other things like that, and things that you're like, people like you are heading, are helping to retain people and bring them back to their communities, serve as primary care docs, and to really enhance and evolve medicine in Montana. And so I'm curious, could you elaborate a little bit on the residency program that you are a part of, just a little bit, and the opportunities that creates for people interested in family medicine in Montana?
Yeah, absolutely. So I work with the Family Medicine Residency of Western Montana. We're based in Missoula and Kalispell. I work in Missoula. And the program is relatively young. There's a family medicine residency that's been in Billings, Montana Family Medicine Residency for many years, decades, and they were really the first and longest here in Montana. But here on the western half of the state, we didn't really have a lot of graduate, as we call it, graduate medical education. Medical school, we call undergraduate medical education. So residency is graduate. So just about 10 years ago, a little bit more than that, a group of physicians in the western half of the state really started to look at the resources that were here to be able to support teaching residents. We had medical students in our region, but not necessarily a formal residency program. So between Missoula, Kalispell, and the various healthcare resources that are there, they really came together to develop the residency program. And it very much has a focus, like all the topics we've really been talking about here, in terms of training family physicians for the rural and underserved communities of Montana. And of course, we have graduates that go other places too, and that's okay. But we've been really fortunate that just about 75%, give or take, of our graduates thus far, and we've had 5 classes, have all stayed in Montana, which is pretty exciting for us. So it tells us we're doing something right. And about 55% of those residents practice in communities that are 5,000 or less, which would be considered kind of frontier communities, which for us in Montana is what we really mean by rural. Like Helena doesn't feel rural if you're in Montana, but it does if you're probably in Chicago or Rhode Island. But at any rate, so we really focus our training with that mission in mind. And for me, when I was looking at the job opportunity here, it really just made sense for my passion for these issues and wanting to really contribute to workforce. It just made sense to join the faculty here, and was really lucky to have that opportunity. It was very similar to my own residency program in terms of mission, and so it felt like a good fit.
Yeah, it's a great opportunity to have here. I'm curious, I have to ask, do you foresee on the horizon a medical school in Montana?
Oh, that's an interesting question. I don't know. You know, it's challenging because in my opinion, there's a fine balance between trying to have lots of different sources of that education versus making sure we don't oversaturate and maybe have more need than we are able to fill, in terms of especially for many instructors, you know, family physicians and other physicians that teach. A lot of times that's volunteer teaching, a little bit different as a residency faculty for me, but for a lot of folks that medical students may do their rotations with, and some residents too, they're volunteer teachers. And so we have to be careful, you know, to make sure that resource is not totally oversaturated, so that the students we do have here now can continue to get a good experience. You know, we've got students from University of Washington, Pacific Northwest University in Montana on Montana tracks. So we've had that presence, but it is interesting. It's definitely been a conversation that's gone back and forth in the state. And in the end, you know, we of course want to all just support more access for medical education for our students who are wanting that path. It's interesting, in the residency world, we tend to see, when you look at where students go to medical school versus where medical students do residency, in terms of retention in an area, residencies tend to have more of an impact where you do residency is more often where you're likely to practice in the vicinity of, versus medical school. People often end up leaving their medical school region to go to residency, not always, but residency is a better predictor of where you'll practice, is basically where I'm going with that. So it's an interesting thought, how do we get the biggest bang for our buck to keep physicians in Montana? Is it medical schools versus residencies? And there's different goals, they have different purposes.
Right. That's interesting. Thank you for your perspective on that.
Sure.
And so now I'm curious, we've mentioned it before, what is exactly the Montana Academy of Family Physicians? It sounds like the awesomest book club ever currently, but I wonder if you could elaborate on that, how you got involved in it, and what benefits do family medicine physicians have from being a part of it?
Oh, great question. So yeah, the Montana Academy of Family Physicians is basically a state chapter, and every state has one, of the National American Academy of Family Physicians. And so every specialty has its sort of professional organization that represents the specialty's interests, patient's interest in the context of that specialty, et cetera. So for me, I've been involved with the AAFP as a student and for my state chapter back in medical school since I was a first-year medical student. So I've been really passionate about sort of organized medicine, as it's called, and being involved in these organizations, and was able to do some student leadership stuff as a medical student. And then that just kind of followed through my career in residency. And then when I came to Montana, I wanted to get involved with our chapter here. And being involved with that, as a member of the board of directors or other committees, is really in many ways advocating. It's advocacy and also educational programs and pipeline and workforce issues related to training students and residents in our state. It's really all these different issues are addressed by the state chapter. And so it was just a great avenue to stay engaged in things that just go beyond the day-to-day practice in the office. That, as a physician, so much of what we do circles around how do we provide leadership for the issues around healthcare. The last year with COVID has been a great example. But yeah, so as being involved with the chapter, we've been able to do advocacy work back when Medicaid expansion was being voted on, et cetera. We host educational meetings for family physicians so they can do continuing education, because your education doesn't stop in medical school or residency. And frankly, so much changes year by year that you can't stop learning or else you're going to be very outdated quickly. So we offer education programs or conferences for our members. And just a variety of other kind of connections to some resources for family physicians at the national level too. So kind of it in a nutshell, but a great way to get involved. And medical students are members too in the state. So that's kind of neat to be able to have students, residents, and practicing physicians all part of this organization.
That's a great network. It seems like there's great opportunities for collaboration between people at multiple certification levels. And I love how you said that really you got to be a lifelong learner to be a physician. And I think what's the potential changes that can happen in the world and in our nation have become quite evident with the COVID-19 pandemic. And so I'm curious, so the coordination that the Montana Academy of Family Physicians fosters between family docs across Montana and the nation, it's similar to the efforts of collaboration and pooling of resources, information, and inquiry to combat the trying times of the coronavirus pandemic. We've seen networks sprout up that I didn't even know existed. And so how can resilience, collaboration, motivation, and hope towards the alleviation of suffering continue to be fostered among physicians and other health professionals despite separation by large distances and despite indirect means of communication like Zoom right now?
Absolutely. That is an interesting question. I hope I can pull all my thoughts together for it. But I think in many ways, I don't know, I think of it from a family medicine perspective too. And, our worldview is we follow patients through the life cycle, through the ups and downs. We ideally follow them from birth to death. And so this is a phase of our lives that has definitely not been easy and not been quickly. But, I think relationship is such a big, it's the core of what family medicine is about, relationship with your patients over time. You know them, and I think it just speaks in general to the power of interpersonal relationships for resiliency. And so I liken that also for professional relationships. I may not be able to connect with my colleagues as easily right now, like my coworkers that are just amazing colleagues and friends, and even through Zoom, to have those opportunities to share our challenges, to be open about them, to be a little bit vulnerable, to talk about how this has been a tough time for everyone on the planet, really. But I think relationship is what's most important for resiliency, or at least in my opinion. And I think things like, whether it be peer-to-peer or professional organizations where you have those relationships, I think kind of building on all of those to support us through these times is really important.
Yeah, I think we're relying on fundamental aspects of what is being a human being for the most part in these trying times, and I think it fosters some beauty in that as well, because it shows us that we're all human and we're all connected. And that's great. And what better way to see that than to become a family physician? Look at it from the eyes of a family physician that is focused on comprehensive medical care. So it's interesting, and it's trying times, but I think we'll pull through it. And so as the Carroll Pre-Med is listening to this and struggling on their own journey, facing their own adversity, and struggling to connect with other people as well, what final words of wisdom do you have for them?
There's so many things to think about saying there. The path is long, but before you know it, you'll be many years from your college graduation and look back and wonder where that time went, which I know all us, older folks always say that, but right now, obviously so much is, focused on working hard for that path, that vision of your future that you have. And that's so important, definitely doubling down right now on working hard, studying hard, building that foundation to prepare you for med school is so important. But kind of circling back to a point you made earlier in our discussion, still keeping an eye on what makes you whole, because building those skills now will be so important 20 years from now when you're in practice and trying to balance well-being and your personal life with your professional life. And balance maybe isn't always the right word. Integration, it's not always balance. Sometimes the patient care and patient needs need to outweigh in the moment in a crisis and an emergency, but then there's times where your needs are going to need to be considered too. There's this term, physician heal thyself. Like if we don't take care of ourselves in the midst of our training, in our practice, we're going to have a harder time being able to take care of our patients. And that's not a small order. So I think just being mindful in these times of how to take a break, how to take time to foster the things that make you happy, even if that's cooking or baking or running or, playing guitar, whatever it is. Make sure you make time and find ways to integrate that to keep yourself sane and keep yourself whole. And just, I think keep in the back of your mind what ultimately does make you happy. And your life path will probably take many zigzags than you could even imagine. I never would have thought I was going to live in Montana when I was a pre-med in Rhode Island. Never would have imagined it. And I love that because I think back and little did I know what lay ahead for my future. And I'm sure the same is true for all of you. A lot of exciting twists and turns will happen. But try to be careful to not overload yourself with so many things that you feel like you have to do because you should or because someone's expecting you to do it. Now, that being said, you want to work hard and you want to do the things you need to do to apply to medical school, but just be mindful of that balance to not just do everything because some external force told you you had to, or you've been guilted into feeling you need to do this or that. And that's not an easy balance. I still struggle with that. Still try to figure out, what do I want to take on? What do I not want to take on in my own professional life? And that starts as a student. So not an easy thing, but definitely a seed I want to plant because certainly there's a lot of hard work and a lot of stuff you can get swept into in the path into medicine. And you just want to be careful to not lose who you are at the core.
And with that, we end another episode of Carroll PMC's video interview series and wrap up another story for you guys. I truly loved speaking with Dr. Amy Matheny, and I think one of the high points of our conversation had to do with just the fundamentals of being a human being that can truly be elucidated from both a family medicine perspective, but I think have really greatly been highlighted in the stressful times of COVID-19. I think fundamentally we share connection as human beings that at this fundamental, at this microscopic level, at the level of morality and at the level of ethics, we share common characteristics, common needs, and common desires that can be truly fulfilled by a provider that seeks to deliver comprehensive medical care. I love how Dr. Matheny described her path towards becoming a family physician, as well as the philosophy that surrounds being a medical doctor, whether MD or DO. I think she shed great insight into the benefits of preventative care, of long-term care, and of comprehensive holistic care to treating the individual human being holistically, checking all those boxes and making sure they walk out of the office completely fulfilled with all of their medical needs fulfilled, whether direct, indirect, physical, emotional, mental, apparent to the eyes, or apparent to the soul. I enjoyed speaking with her, and I hope you guys learned a lot from our discussion. Thank you for taking the time to listen and or watch me today. Hopefully this helped you guys gain some motivation or some insight into what it takes to be a successful pre-medical student. As always, if you have any questions, please feel free to reach out to your Carroll PMC officers, schedule an office hour slot with myself on Moodle, or consult with Carroll faculty of your choosing. If you like this video, please sure to like it, subscribe to the channel, share it with your friends, give other people insight in what it means to be a successful pre-medical student. Have a great day, and I'll see you all next time.